I'm Sejal. I'm parent to Shiv, who's an 11-year-old boy with Duchenne. So what I'm going to be, I'm one of the patient representatives on the physiotherapy working group, and I'm going to be presenting the patient perspective on physiotherapy. I did walk through this yesterday, but today I'll be providing more details in terms of survey data. So just to recap on what was presented earlier in terms of the survey. So in 2021, the project conducted a comprehensive online family survey to capture patients' experiences. There were 164 responses, the age range being between 2 to 46, and 20% were 18 and over, and 40% were non-ambulant. And we also had respondents from 36 different sites. So first of all, looking at this, we can see that 72% of patients receive care from a community therapist. We hear that there's a need for transfer of knowledge and training for community physiotherapists. We hear that the care provided by community physiotherapists is varied. So while some patients have very good care, other patients feel that their physiotherapists lack knowledge in terms of how to manage DMD. And also community physiotherapists are crucial in obtaining equipment and providing access to essential interventions required to manage DMD. And often the lack of knowledge results in a delay in accessing timely interventions and equipment, specifically, for example, wheelchair services. That is one where parents do have a lot of difficulties. And often we find that they're having to fund and pay for wheelchair services themselves, for wheelchairs themselves. In the survey, we also asked how many respondents had to pay for their equipment, for their wheelchair equipment specifically. And of all the responses, 164 respondents, over £150,000 had been spent by these patients to access the wheelchair, or parts of a wheelchair that is essential for independence. And recently, I'll give you what we experienced with wheelchair services as well. So my son started high school. For high school, he required an electric wheelchair to get around because it's a very big school. We put in the request for a wheelchair a year before he actually needed it, based on our physiotherapist recommendations. School was due to start on the 2nd of December. On the 1st of September, they had told me that the wheelchair will be delivered on the 1st of September. I'm phoning them, can't get through to them. In desperation, on the 2nd of December, I went to wheelchair service and said, nobody's picking up the phone. I desperately need this wheelchair for my son. And they said, yeah, absolutely, we have it. I said, brilliant, fantastic. When can I have it? Can I have it in 4 weeks' time when we can fit him in? And for me, that was devastating. I was overwhelmed. And it came to a point where they said, no, that's it, go home, we'll fit him in 4 weeks. I burst out crying because I remember saying to them, this is my son's legs. He cannot access school without this wheelchair. And then the next day we did have an appointment, but it's the fact that us as parents, caregivers and patients, we have to, it's a battle. It's a battle to access this equipment that really is required for the independence. And also there can be inconsistencies in the interventions equipment requested by neuromuscular physiotherapists and also delivered by the local therapists. So for example, the type of wheelchair, splints, they can be very different. And something as well that we were speaking about in our working groups yesterday as well, there's also something that Philippa mentioned this morning in terms of equity of access around the UK. Sometimes it is a postcode where certain things are available in north and not available in the south, or available in the south and not in the north. So this is something that really needs to be addressed from a patient perspective. 43% of patients in the non-ambulatory phase are not seen by a physiotherapist. There are So two reasons for this. First of all, some patients feel it's not needed. So here there's an opportunity to educate patients on why it's vital to see a physiotherapist, even in the late non-ambulatory stage. And also, secondly, because they just don't have access. So and patients feel that access is required to manage and prevent muscle tightness and cramps, to advice on how to manage physical changes, and also for managing compromised skin integrity. So 23% of patients are seen by their 23% of the neuromuscular, I'll start again. Sorry, I can't see the 23% of patients are seen by their neuromuscular physiotherapist less than every 6 months. So patient caregivers want regular routine assessments to ensure that any changes in functions are addressed promptly. And 90% of the respondents were shown how to stretch. So this was when they were first diagnosed. But what we did find is that the stretches are not being routinely updated. And patients really want the stretches to be routinely updated, especially when if there's a change in function. We as patients want the confidence to be able to help our children, men, boys, with the stretching. And also patient caregivers want to be educated. So they want to be educated on the standard tests required at each neuromuscular physiotherapy appointment, the standard tests required at each disease stage. So for example, when is a North Star assessment required, when is a pressure sore assessment required, and what the results of the test actually mean. So what does a contracture ankle, a -5 contracture on the ankle mean? What does this mean for everyday life? And what does, if the North Star has decreased, what does this mean? What does this mean for everyday life? And also the recommended interventions for each stage of the disease. So for example, when is function? So when is a cough assist likely to be required? When will pressure sore management be required? And also the recommended mobility devices and other equipment by disease progression. So for example, when do you switch from electric wheelchair to a manual wheelchair, when an AFO is required, when a CAFO is required. And something else that we did pick up as well is that patient caregivers want their anxiety managed. They don't want too much information too soon. So for example, at time of diagnosis, the parents and caregivers don't necessarily want to know that their son at that stage will, when he's older, require a cough assist or ventilation. So in conclusion, so want regular routine assessments to ensure that any changes in function are addressed promptly, access to care in all stages of the disease, knowledge transfer education for community physiotherapists, stretches to be routinely reviewed, and timely access to relevant interventions and mobility devices based on stage and function. Caregivers want to be educated, and there's also a need for patients to be educated on the importance of physiotherapy at all stages of the disease. Okay, thank you. Thanks, Sajal. That's great. Anna, are you going to take over?
Yep. Ably assisted by Meredith chip in. So thank you very much, Sajal, and we really had some good discussions yesterday and are pushing the board forward. The family survey has been very helpful, but we did also have a PT survey as well, which has also assisted us in next steps. Next, please. So to summarize, we're talking very much about knowledge here, and it's not just about increasing knowledge, it's about understanding what that knowledge means. And because we're talking physiotherapy, we're talking very much about actually improving skills in assessment and management, and they can be very practical. We know that that knowledge needs to be communicated and transferred amongst multiple teams, and it's probably very clear to everyone that physiotherapy has a little finger in so many of these different working groups. Luckily, there's lots of us to assist in that, but here it is about making sure that the same information that comes from a specialist team is communicated beyond that to other teams, and that even between teams that communication happens. We have talked a lot, and Sajal certainly touched on this, that it's very important to understand what assessment needs to be done, when and how, and make sure that it's done reliably. But actually, what does it mean? And what does it mean in terms of management? Okay, so it's not just a number plucked out or given. And the same goes for management. People need to understand what needs to be done, when and how. And as we've already talked about, it needs to be tailored. It needs to be appropriate for age and stage, and regardless of language ability. Next slide. So there is work underway, and we wanted to talk first about what we're actually doing. So there is, for the working group, there is actually a physiotherapy guide for UK therapists based on those international standards of care. We are very lucky to have a very active and proactive and long-standing North Star network, both adult and paediatric. I'll talk a little bit about an online educational package called opentech.net, and some other work ongoing. Next, please. So the guidelines, we are not as far on as some of the other groups. We are still on kind of draft 1 of where we're up to, but the plan is to have 2 documents, one which is particularly aimed at specialist and community physiotherapists working with Duchenne muscular dystrophy, and then there will also be a family guide which are aimed at families and young men. And we have divided this up into different phases, and I would like to thank Marina DeMarco in Glasgow for a huge amount of work that she passed on to us to make our work easier. And we've divided it up in the same way that the standard of care document does. What is very important, we think, is that people understand that these stages are not discrete. There are points of movement as young men and boys move through those stages. We also talked yesterday about we need to be very clear what we mean by the word transition, and it may mean something very different to youngsters than it does to us oldies. So we felt it's important that we build a framework for disease stage measurement, so that we're using a very similar and clear framework for how we define these things. These documents will be designed to be very practical. Both documents will include references and hyperlinks to different resources, because there is a lot of resources available out there. Next slide, please. So this is an example of what we've been doing, and we're not quite sure how we're going to present all this information yet, but this is an example of an early ambulant advice. We talk about describing the stage, which assessments are used, the main role of physiotherapy intervention. We are working on the assessment of respiratory and linking that in, obviously, what's happening with the respiratory group. We very much want to cover the use of orthotics within our work package here. And there was a lot of discussion yesterday about ensuring that we include information about equipment and occupational therapy. And one of our next steps will be to take on board some more input from OTs in the world of neuromuscular. We touch on orthopedic because it is about that assessment and liaising again with the orthopedic team. And we talk about different specialist services that may be involved at different stages, so that any physiotherapist accessing this material has a rounded picture of what's happening, and that includes education and employment. Next slide, please. We have talked about different ways of presenting this, and it could be that we actually deliver some of this material in video form. It could be an audio guided PowerPoint, it could be practical videos, etc. We're not absolutely sure yet, but there are different ways of doing it, and we want people to understand the way that the community team should interact with the specialist team, but that they do have separate roles. Next slide, please. So the North Star Network has, as we've already said, it has a lot to offer us, both in terms of systematic and consistent measurement. We are very fortunate to work with the physio coordinators, Alex Petrus, and hopefully a new paediatric coordinator be appointed soon. We know there's work to be done on updating some of the paediatric forms to include some of the more recent assessments, the EK2 and PUL. That is work that's already been done between the adult and paediatric network, where we do not see a distinction. We very much see a kind of a seamless set of assessments. And there was talk yesterday about making sure that we focus on abilities of these boys and young men. And for that reason, we may use something called the transition assessment, which is all about trying to capture abilities as an individual is finding the North Star difficult, but we need to focus on other important skills, such as the ability to transfer. Next slide, please. OpenTact has been up and running for a couple of years now. It's an online resource open to community and specialist therapists, and it is another point of transition, used in a slightly different way, where we are now working with Treat NMD and looking for ongoing funding to take this to the next level. It already has a lot of information on it related to Duchenne assessment and management, but the idea is that this will provide a more structured e-learning modules, which will allow the introduction of quizzes and reliability testing for the different assessments, and will also allow physiotherapists to register the work that they have done as continuing professional development. This is something that will kind of morph into something a little bit bigger, where we will actually have a steering committee, and the networks and other experts in the field will be involved in the production of material for this. Next slide, please. I think the important thing is that we are going to make use of what we have and work with this working group to put those materials on such a resource that already exists. We're also doing some work about the interpretation and understanding what the total score on the North Star means. And this is work that we've been doing with an enormous amount of data from the North Star Network with Georgia Stimpson, who's a statistician in London. And we have been looking at just by taking the total score on the North Star, what that means an individual is able to do, and more importantly, what that means in terms of management and delivering a standard of care, to make families particularly aware of interpreting that score and where that places them in terms of what's important and planning for next steps. Next slide, please. And again. Okay, and so especially as the North Star score is falling, we're trying to focus on ability and then link that with other important considerations for management and transition to loss of ambulation. Next slide, please. Okay, but we do know that from the physiotherapy survey that we have gaps, and I think that Sajal has covered that very well. We talk about frequency of assessments. We talk about the type of assessments that's used, and that's something that we've taken on board here. I'm not going to cover that in great detail, but there was a lot of talk yesterday about some other information, particularly captured around wheelchairs and making sure that the right wheelchair is given. And there was some really interesting talk yesterday about actually looking at having a template for educational and health care plans, which would include key sentences and recommendations for equipment prescription, which would facilitate therapists to write to help in writing an EHCP that actually produce the results for families. Next slide, please. Other potential solutions, we already have an application underway with Duchenne UK, looking at a family-based app, and there's already been a lot of talk about that this morning. What we don't want, I'd just like to make it clear, is for you to have 10 apps on your phone that all do something similar, but not quite. We want to work together to make sure that we deliver. But what we were thinking in terms of a physiotherapy app is to have a digital patient-led platform which would actually improve patient and carer awareness, knowledge, motivation and adherence to the management of range of motion. And that would be something that would be applicable to the youngest boy, to the adults and those at a late stage. I call it the COCO app just because it is about that communication and collection of satisfaction and how different ways of managing range of motion is happening. And the idea that this could be a proof of concept in managing range of motion, which is a big issue, but only one part of physiotherapy management. And it could be something that, that could work in other areas of the standard of care. But it is particularly aimed at that highlighted issue with communication and better knowledge transfer between teams. We're aware that that may well benefit from video education because of the practical nature of what we do. We have talked about adding OT equipment and wheelchair information to that. We also know that we need to work with communities where English is not their first language. And we also recognise that in terms of research evidence, that's not always available for physiotherapy input, and that as a community of physiotherapists, we could benefit from the use of case studies and examples of care. I think another important point to make is that sorry. Thank you, Kathy. It's absolutely fine. Next slide, please. Okay. I think the other important point is coming up in this next slide. So the plan is to have draft 2 of these physio guides to the standards of care prepared by Easter, and that it's very important, and we are already working with input from families and individuals very much who are enmeshed in those different phases and stages. Because that's when you are hyper alert to issues and the importance of different aspects, that following the generation of that draft 2, we would probably have a hybrid meeting after Easter. We are very cognizant that the work to be done in the physiotherapy working group is based on practical delivery of information, but we do also now realise that we probably need to plan a publication as well, because that gives a weight of evidence for families and staff in securing equipment and opportunities. But that as a working group, we probably need some financial support in terms of project lead and that publication. And that's something up for discussion next. Is that my last slide?
It is.
Excellent. Okay.